Hello everyone. Today we'll be discussing about the term CP, that stands for cerebral palsy. Now it's an important term when we think of the pediatric physiotherapy. So what is cerebral palsy? Cerebral palsy, it is usually a non-progressive disorder. This is an important term, non-progressive disorder of motor function that results from damage to the immature brain, either before birth, during the birth time, or after the birth, within 1 year of the uh, life. Now, the basic symptoms a cerebral palsy child will be showing is there could be drooling of the saliva, there will be delayed milestones, like if the child is 8 months old, he is not able to sit yet. So all the milestones, they are achieved either late or they are not achieved at all. Like if the child is 1.5 year old but he's still not able to walk, or the child is walking on toes, or there are crossing of the legs, or if there is a W sitting, the child shows W sitting, or there is excessive dorsal kyphosis, the hand is not used properly, there is fisting of hand, any convulsions or squint in the eyes can be the symptom of cerebral palsy. Now, so the patient will usually present as delayed walking or any abnormal movements of hands or legs, like there could be any twisting, any jerking of the hands or legs, or there could be the stiffness of the body. Spasticity could be there, due to which normal movements are not being performed properly, or the child is habitual of sitting in the W sitting. So, as we talk about that, this damage can occur either prenatally, during, or after the birth. So, the prenatal factors which are related to cerebral palsies, that includes the maternal infections, any placental malformations, any genetic influences, like due to the genetic malformations the cerebral palsy occurs, or if the mother have diabetes, the child is more prone to have CP. Any brain malformation and improper growth can lead to the prenatal factors which are related to the cerebral palsy. Now, perinatal factors, this could be asphyxia or anoxia, that is lack of oxygen to the brain of the child during the birth. If the child is having low birth weight, if there was breech presentation, and also the prematurity, that could be the reason, perinatal factors that can be related to the cerebral palsies. Now, postnatal factors, which are usually seen in the first year of life only. So it could be any cerebral infection that occurs in the child, any cerebrovascular infections, any head injury or trauma that occurs to the child, that can lead to cerebral palsy or the damage to the immature brain, and the seizures. So that can all lead to the these all factors can be related to the cerebral palsy. Now, talking about the classification of cerebral palsy, so we can classify in different manners. So if we're talking about the classification by type, so by type it could be spastic, dyskinetic, ataxic, and hypotonic. So spastic means there is a increased muscle tone, and spasticity is defined as a velocity dependent increase in the muscle tone. So the patient could be having a poor head and neck control, he could be having contractures, or he could be presenting with decreased ambulation. Dyskinetic cerebral palsy, in this the tone usually fluctuates low to high than to normal. The ethioid cerebral palsy, also known as the dyskinetic cerebral palsy, it displays the disordered movement, specifically in the mid-range of the affected extremities. Third classification is ataxic cerebral palsy. So in this there will be decreased coordination, low postural tone, Usually the patient will be diplegic. It have a wide base of support in standing or walking. And fourth classification could be, that is hypotonic cerebral palsy. In this, there will be decreased muscle tone and weakness, and also this is known as a flaccid cerebral palsy. The patient is totally flaccid. So if we classify this cerebral palsy according to the type, so it could be spastic, dyskinetic, ataxic, and hypotonic. Now, if we classify it by distribution, so it could also be classified as hemiplegic, diplegic, quadriplegic. Like hemiplegic means only one side is affected, diplegic means only lower half of the body is affected, or quadriplegic means the whole body is affected. So this is the basic classification of cerebral palsy. Now, if we talk about the treatment part, and talking specifically about physiotherapy treatment, so physiotherapy treatment usually focus it on the motor learning of the normal purposeful movement, and we just concentrate more on the neurodevelopmental therapy, which focuses more on the motor learning of the normal and purposeful movement, so that it could be learned by the child and he is able to perform his ADLs. And usually we follow the developmental sequence, like from supine, then we try to achieve rolling, then prone, quadruped, sitting position, then from sitting the scooting position can be done, and then we go for the sit to stand position. These are all the developmental sequences, and we try to achieve these sequences by focusing more on the neurodevelopmental therapy, or by training the motor learning process. So following by sit to stand, we can go for standing, pre-gait activities, and finally we concentrate on the gait activities. So this is all about the cerebral palsy. This is just a journal information related to cerebral palsy. Thank you.